Maternal mortality is a health problem facing women around the world. Let's investigate what impacts this health issue in the United States, Ireland, and Pakistan. I'm Emily Dansack, and here is what I discovered. Maternal mortality is a health problem that impacts all areas of the world. The World Health Organization has defined maternal mortality as the death of a woman while pregnant or within a period of 42 days after the termination of pregnancy. Although the mortality ratio has dropped by almost 40% over a 23-year period, it remains a health problem in developed and undeveloped countries. The rate of maternal mortality is unacceptably high. The high numbers of maternal deaths stems from the inequality in access to quality healthcare services. The number of deaths can be impacted by economics, socioeconomic, and the nature of the healthcare system in an individual country. The United States is the wealthiest country in the world. However, there are areas in the country that have a higher maternal mortality rate. The U.S. has a GDP of $27.72 trillion in 2023. The median household income was 80,610. The life expectancy in the country is 78.4 years. The Republic of Ireland is a developed economy with a GDP of 551.4 billion US dollars. The life expectancy in Ireland is a high at 83.06 years. An infant mortality rate of 3.0 deaths per 1,000 live births is relatively low. Only 5.3% of the population is living in poverty. The country of Pakistan is a developing economy with a GDP of 337.4 billion in US dollars. The average life expectancy of the population is 66.45 years. The country is relatively poor with a 44.7% of its population living in poverty. The median household income is only 587 US dollars annually. Income is not the only factor contributing to the access to quality healthcare. Often the type of healthcare system of a country will also play a role in getting good healthcare. The United States, Ireland, and Pakistan all have different systems in place. The system in the US is a mixed healthcare system. Public and private funds are used to finance the system. Public funding consists of Medicaid and Medicare. Private funding is through insurance coverage from the benefit of employment or the marketplace. The system is plagued by inefficiency and high cost. Ireland's public healthcare system was funded at 77% of government in 2023. Private insurance is also available. The delivery of services is via a mixed system of hospital care and primary care physicians. Ireland is looking to reform the system and move to universal healthcare. Pakistan's system is funded through a mix of private and public sources. Unfortunately, the public portion is underfunded. Private insurance is expensive and difficult for the country, difficult for the ordinary Pakistani to purchase. The delivery of care follows an old British model of primary, secondary, tertiary care. The majority of pregnancy-related deaths now occur in the postpartum period. Major reasons for maternal mortality include the lack of community-based care and pervasive racial and socioeconomic health issues. The most defined maternal mortality rate in the U.S. is defined by race and ethnicity. Challenges include the rapid decline of health of Black women in the U.S. during prime childbearing years. Community access to care is also a significant issue. At one time, thrombosis was the highest cause of maternal death in Ireland. However, the rate was less than the overall European rate. Studies have found that the majority of maternal mortality cases are linked to provider issues in the country. These can be improved by better provider training and public education on health. In Pakistan, the maternal mortality rate is almost 26% higher in the rural areas of the country. Poverty has also emerged as a significant risk factor in maternal mortality, and poverty contributes to the underutilization of facilities. Pakistan faces challenges in their system due to their status of a developing economy. There's an uneven distribution of services. The system is underfunded by the government. The end result is that there are too many financial barriers to access services. Customs and traditions also play a greater role in Pakistan than in the US or Ireland. Many women follow age-old customs that are outdated, and many are also not educated formally. There needs to be greater emphasis on education of the public, especially women. Females who are illiterate and live in rural communities are also likely to be vulnerable to traditions and outdated customs. These women are likely to marry at an early age. The legal age to marry for a Pakistani woman is 16, but some arranged marriages may have brides as young as 14 years. Ireland is somewhat different from the US and Pakistan as the nature of the healthcare system. The majority of the healthcare system is a public one, and the country is looking to reform the system to a universal care system. The US is a mixed system using both public funds and private insurance. The Pakistani public system is severely underfunded. The US can achieve more successes if the healthcare system is streamlined and becomes more integrated. The system needs to be reformed to become more efficient. Continued improvement in the training of nurses and primary care physicians may also help lower the rate of maternal mortality. Pakistani system severely lags behind the US and Irish systems. Challenges include the lack of skilled staffing, the lack of community facilities, the lack of public education, and traditional customs. The US and Ireland do not face similar challenges in their systems. Women in rural or poor areas are least likely to receive adequate care or access to quality care. Higher and middle income countries benefit from these economic conditions, which attract skilled providers. Over time, new strategies need to be developed and implemented to improve maternal care and newborn health. Thank you.